Hello and welcome. During this segment, we will demonstrate the first-time setup of VetDAR, Veterinary Digital Anesthetic Record-Keeping Software. We will open VetDAR and log in using the default password, which is password in all lowercase. Next, we will agree to the stipulations associated with the formulary's use. We will go to the program icon in the upper left corner and click on it. A pull-down menu will appear. To customize the software to your practice's needs, you will need to log in as an administrator. Click on that prompt, and the username is admin, and the default password is admin. First, we will go to the program settings, cursor down to the active monitors, and select it. When VetDAR is loaded, the default is for all monitors to be enabled. The user should unselect all the monitors used to assess vital signs that are not available to the practice. Doing so will prevent the software from asking the user to supply vital signs data that the user is unable to obtain. While in this submenu, please select the units you wish to use for temperature, whether Fahrenheit or Celsius, and the units for weight, pounds or kilograms. Next, we'll go back to the program icon, click on it and select Administrator Users. Complete the fields to add a new administrator. One will have to load the new administrator's signature as part of the process of adding new administrators. Next, we will go back to the menu, Program Settings, and select Drug Names. There is an extensive list of anesthetic drugs and ancillary drugs loaded into the software. If one wants to add an additional drug, then one clicks on the Add New prompt and enters the new drug, and then click Add. It is suggested that the generic name of the drugs be used. Drugs added by the user will not have the doses calculated for individual animals by the software. Dimple Hill software programmers will have to add the drug to the list in order for the doses to be calculated. However, the user can add drugs to the software's database in order to avoid having to type in the drug with each use. And returning to the program icon and program settings, we will look at our list terms. There are a number of subheadings off of this menu, and they include breed, catheter sites, complications, fluid types, laboratory tests, participant name and type, procedures, recovery quality, recumbency, species, and units. There is an extensive list of breeds loaded into VetDAR, and additional breeds can be entered by the user adding the Add New feature. When adding a breed, you must first select your species, and then you're able to add a new breed. Returning to our program settings and list terms, we will look at catheter sites, and there is an extensive list of catheter sites preloaded into the software. If a vessel is not listed, you can click Add New and add it to the list. Returning to list terms, under complications, there is an extensive list of intraoperative and postoperative complications loaded in VetDAR, and additional complications can be entered using the Add New feature. Names of commonly used intravenous fluids are also loaded into the software, and additional fluid types can be inserted using the New Item feature. Also under list terms are commonly used laboratory tests. These include AST, BUN, CK, glucose, hematocrit, total protein, and new items can be added using the New Item feature. Also under list terms are participants. The user will have to add the names of the personnel who will be acting as participants in the procedures with the Add New feature. There are also a number of participant types loaded into the software. These include anesthesiologist, anesthetist, anesthesia student, anesthesia technician, anesthesia resident, surgeon, surgery resident, surgery technician, internist, etc. Additional personnel types can be inserted with the Add New feature. Also under list terms, there is an extensive list of procedures preloaded in the software. Additional procedures can be entered by the user using the Add New feature. Returning to our program settings and list terms, there are several terms for recovery quality preloaded into the software, including dysphoric, excellent, good, etc. Additional terms can be inserted using the Add New feature. There are also many terms for recumbency preloaded, including dorsal, left lateral, right lateral, etc. Additional positions can be inserted using the Add New feature. Next is a list of species that are preloaded into the software. Additional species can be inserted with the Add New feature. Lastly, under Program Settings and List Terms are units, and additional units can be inserted into the program with the Add New feature. And that concludes the medical terms. Returning to the program icon and program settings, next will be medical gases. The software comes with all the medical gases enabled. They include oxygen, nitrous oxide, medical air, and heliox. If you only use oxygen as your carrier gas, then nitrous oxide, medical air, and heliox can be disabled. Returning to program settings, next is the patient assessment sheet. The user can change the default names of the section headings and descriptions if they desire. Next is an option for changing the password, and it is recommended that the user change the default password for their clinic or hospital. And next is the report header. The user must change the default letterhead to that of their clinic or hospital. Lastly, under program settings, are the interval timers. The default interval for vital signs data entry is 5 minutes. The default interval for temperature is 30 minutes. The default interval for a reminder tone when the software is asking for vital signs data is 15 seconds. The user can alter any of these intervals to suit their needs. That concludes our first time setup of the software, allowing one to customize VetDAR to their individual needs. We'll now close the program.